Good evening, everybody. Isn't it nice to be in person and not like spread all over the lecture theater? My name is Tanya Bubala, and I am the Dean of the Faculty of Health Sciences at Simon Fraser University. And it is my great pleasure to welcome you to tonight's Varshney lecture. So the Varshney lecture is funded in partnership with the Indian Council for Cultural Relations, and some donors are here with us today. First, Hari and Madhu Varshney. Their significant contribution has enabled us to endow the Varshney Lecture Fund so we can provide these public lectures into the future. And Barj Dahan and Sarup Man also contributed to the fund and were instrumental in bringing this opportunity to SFU. We thank them all for their vision and commitment, and we're so glad that they can join us today. So it's my great pleasure to introduce our speaker for tonight. Dr. Prabhakaran has came to us before COVID. Because of his position at the Public Health Institute of India, he was unable to come for a 3-month consecutive stint. And so he came for 6 weeks pre-COVID, and now we're lucky for him to come back to us for 6 weeks post-COVID. So it's been a very long Varshney scholar time. So Professor Prabhakaran is an internationally renowned cardiologist, epidemiologist, and researcher. His initial training was from the prestigious All India Institute of Medical Sciences and McMaster University. He is currently the Vice President, Research and Policy of the Public Health Foundation of India, Executive Director of the Center for Chronic Disease Control in New Delhi, and the Professor in Epidemiology at the London School of Hygiene and Tropical Medicine in the UK. He has multiple visiting professor appointments, including at Harvard School of Public Health, McMaster, and Emory Universities. Recognizing his contribution to Indian science, he was elected as a fellow of the Indian National Science Academy, the highest science academy of India. His work has led to understanding the underlying mechanisms for the high propensity of diabetes and heart disease in the South Asian community. Dr. Prabhakaran is a visiting professor in the Faculty of Health Sciences at SFU, and his appointment here was made possible through the Hari and Madhu Varshney Visiting Scholars Program in Indian Studies. And with that, I will invite him to the podium for a riveting lecture on healthy hearts.
So good evening, everyone, and thank you, Dr. Bubaya, for that very kind introduction. So first of all, my gratitude goes to Mr. and Mrs. Varshneys, Mr. Dahan and Mr. Maan for making it possible for me to be here and give this talk. Thank you very much for that. And I'm also grateful for all of you for being here to listen to this talk, given that it's kind of late evening for most people. So what am I going to talk that you do not know? All of us know that, having a healthy lifestyle is very important. But I'm going to give 2 important headline messages. Number 1 is we need moderation, not martyrdom. At the end of the talk, you don't have to become martyrs and say, I'm not going to eat anything and I'm going to live frugally like a sage. You need to enjoy your life. You need to eat everything. But how do you eat the right thing is one thing which I'm going to talk about. The second headline message is that if we eat healthy, not only do we add years to our lives, that is, we live longer, but we also add life to years so that we are happy and healthy. So that's the focus of my talk today. How do I move this? Do I use this to change? No. Can you help me? But the mic is. I hope you're able to hear in the back. Right. Okay. So first of all, let me start off with an apology for people who know all of this. I just wanted to keep it simple so that it covers a wider audience. So the first question that we need to ask is, what are heart diseases? Heart diseases encompass a variety of disorders, starting from heart attack, angina or chest pain, heart failure, and several others, including high blood pressure, diabetes, which is a major risk factor, and peripheral vascular disease, which is gangrene of the foot, and obesity, which all of you know. So these are the major heart diseases. There are, of course, others like irregularity of the heartbeat and so on and so forth, which I'm not going to talk about. But these diseases are impacted we do, and that's what I'm going to talk about. So what determines heart disease? So if you have to think of the causes of heart diseases, we can classify them as which are under our control and that we can modify them, and some we cannot modify. And let's look at what are the things that we can modify. So we can again think of it in three ways. Number one is behavioral, that is our own actions, or I wouldn't say that because otherwise it would be like blaming ourselves, but it is what is conditioned by the society and what we follow. And these are four important things: tobacco, diet, physical activity, and stress. The next is biological, which is, we all know, is high cholesterol, um, hypertension, bad dyslipidemia, diabetes, and obesity. These four things, which are considered biological because there is a basis because of which we develop these conditions. And last is environmental, which is an emerging program, and that has air pollution, water pollution, heavy metals in the water, noise pollution, light, and so on and so forth. The non-modifiable factors are family history or genetics and age. As we grow older, the chances of getting heart diseases are higher. So these are really non-modifiable. You cannot grow younger, obviously. So as we grow older, we get these diseases. But as you can see, a large majority of the things are under our control, and let's see what we can do about it. But many of my patients come and say, sir, I read it in the Dr. Prabhakaran, I've read in the newspaper, and this is what they say, that it is genetic. So when you say it is genetic, you virtually become fatalistic and say, oh, you can't do anything about it. The fact is, yes, genes play a role, but they do not play the major role. They do not play, you know, they do not completely influence the occurrence of this disease. So what do? There are some genes, yes, which really increase the risk of heart diseases, but they're extremely rare. And they're so rare that it's something like 1 in 10,000 people may have, but now we have techniques of identifying such genetic disorders and treating them. But the common garden variety of heart diseases uh, are not influenced by these genes. There are, of course, others who argue that there are some common genes which increase the risk. Yes, there are some common genes which can increase your blood pressure, which can increase the risk for diabetes. But what do they really do? As compared to the average population, they increase your blood pressure by 4 to 5 millimeters of mercury. So you really require a second hit from your diet, from your lack of physical activity, consumption of alcohol, and so on, to actually make you a hypertensive or to make you a diabetic. Then, by contrast, if you look at the common risk factors, smoking, hypertension, high cholesterol, and obesity, they all increase the risk of having a heart attack at least 2 to 3 times. It's 2 to 3 times higher for people who smoke, actually 3 times higher for people who smoke. People who have a bad diet have almost 50 to 60% higher risk. People who have hypertension have a risk of having a heart attack or stroke, which is 2 to 3 times higher. So as compared to genes, the risks imposed by these common risk factors are much higher, and therefore we need to focus on them. So diet, physical activity, and smoking are actually the major drivers of heart disease in the population. But a combination of bad genes and bad habits are really lethal and diabolic, as I would like to call it. So it is said our lifestyle actually determines what happens, and it's half the problem amongst humans. In fact, there's a website called 3450. I don't know whether it still exists. It was there around 10 years back. And they actually conveyed this very simple information that 3 risk factors, unhealthy diet, tobacco use, and physical activity, cause 4 major diseases: diabetes, heart disease, lung disease, and cancers, which results in 50% of the death worldwide. So you can see the power of these 3 risk factors: diet, physical activity, and smoking. So that's why they called this website as 3450, and it was a very catchy phrase. And you might think this is very new. This is all science that has brought about this knowledge. But every philosopher in the world, every ethnicity, every culture, every race had one philosopher telling that you have to eat the right thing. I'm just quoting because I know these 2 languages very well, Tamil and Kannada. I'm quoting 2 philosophers. The Tamil philosopher who lived in 3 AD said, "As pleasure dwells with him who eats moderately, so disease dwells with the glutton who eats voraciously. Ambrosia, or the nectar of life, when consumed in excess, can be poisonous." And the Kannada poet and philosopher who lived in the 16th century AD, he said, "A sage or a yogi eats once a day, a foodie eats twice a day, and a patient eats thrice a day. And the person who eats 4 times a day, 4 meals a day, it takes 4 men to carry you to the funeral pyre." So they knew that eating a lot is bad for your health. So at the end of this talk, I don't want you to say, "Dare I eat tonight?" I mean, diet could be an acronym for "Dare I eat tonight," but I've changed the acronym to say, "Do I eat right?" After my talk, I want you to ask this question, "Do I eat right?" rather than say, "Dare I eat tonight?" And the second thing, when we ask about diet, a lot of people, I don't know how many of you read Alice in Wonderland. In Alice in Wonderland, you have the Mad Hatter's party. In the Mad Hatter's party, every sentence has to have an opposite. So you say, somebody says good morning, so somebody else has to say good night. So it has to be the exact opposite. This is what happens with diet. You read about, today they say coffee is good for your heart, and tomorrow somebody else might say it's really bad. Or they say black tea is good, but you add milk to it, it becomes bad. So you get very, very conflicting reports about diet. And so people get very confused. So one of the things, purpose of this talk is to clear some of that clutter and see how we can actually have the right kind of diet. So my questions are only threefold. Why is diet so important to the heart? What are the controversies and what are my recommendations? These are the 3 things I just want to talk about. So diet is linked to heart disease in many ways. It increases, bad diet increases the risk of heart attack. It increases the risk of stroke, diabetes, high blood pressure, obesity, and it actually increases the risk of having another heart attack if a person who's already had a heart attack follows a bad diet. So diet plays a major role in determining heart attack. So when we talk about diet, confusion arises because whether you're going to talk about what you eat as a whole, or you're going to break it down into various components and say, "Oh, eating this component is bad, eating this component is good." So just for the purposes of clarity, a lot of people who talk about classification of diet into 3 or 4 ways. So one, the major components of diets are carbohydrates. Carbohydrates are the fuel for your body. So if this is evolutionary, because man was a hunter gatherer, he needed to have that instant energy to run away from danger, and so carbohydrates provided that fuel. But we have become more sedentary now that it's become kind of redundant, so it goes and gets converted into fat and gets deposited in the body. So fat is a reserve for you in terms of, and fat was important in terms of famines, in terms of droughts. When you didn't have enough food to eat, the body burnt that fat and gave you the calories or the energy that was required for your day-to-day functioning. The third component of diet is proteins, which are building blocks, which are required for your muscles, which are required for your strength. So these are the basic things in terms of the diet. Then we have micronutrients, which are important for various functions of the body, such as vitamins, antioxidants, and several others, which are important in preserving the cell functions and therefore preventing heart attacks, strokes, and so on. So these are the 4 major classifications of the diet. And of course, there are harmful things like salt, alcohol, and so on, which are also part of the diet. But the concept which people do not understand or people have been thinking about is over the last 60 or 70 years is trying to identify that single nutrient which is bad for your heart or bad for your health, as opposed to looking at what people eat as a whole. As somebody said, science is reductionist because science is built that way, that we go to the smallest molecule and decide whether it's bad or good. But the solutions to humankind has to be holistic. So you have to think about it in a wholesome manner to get a solution. So we need to look at total energy intake and portion size and moderation. Now this graph is a little complicated, but it's a very, very simple graph. All it shows is the intake of calories has increased over the years. So you can see two dips there. One dip was the 1943 Great Famine of Bengal, which reduced the calorie intake tremendously and caused a huge loss of lives in India. The second dip, which you see, is from China, which was the Cultural Revolution, which happened in the late 60s, which was imposed by Mao Zedong at that time. And there was, again, huge loss of calories. But other than that, these two episodes, the whole world has increased the intake. On an average, it said Canada has increased its calorie intake by 400 calories per day in the last 30 or 40 years, which means that you really do not require that extra calories because people earlier were also quite active. They had that 400 calories less, but were quite active. The second thing that has happened is we become physically inactive. So essentially what we are doing is we are eating more, we are less active, and all of that is getting deposited and we're becoming obese, which is leading to multiple other diseases. So I'm going to break down and talk about the three important, at least the two important components which are bad, that is fats and carbohydrates. When we look at fats, I don't know, many of the people of my age would have seen a movie called The Good, Bad, and Ugly by Clint Eastwood. So apologies to him. We have good fats, bad fats, and ugly fats. So what are the good fats? The good fats are present in all the foods that we eat. You might think that green leafy vegetables do not have fat, even spinach has fat. So the good fats are basically what we call as unsaturated fats. So people, when we go back to our chemistry classes of our 9th grade and 8th grade, we know that fats are made of components called fatty acids. So whether the carbon to carbon and carbon to hydrogen is saturated or not determines whether it is a saturated fatty acid or unsaturated fatty acids. Let's forget this complicated figure. It just shows that's the kind of figure that fats have. So fats are made up of fatty acids, and a fat is determined by the number of fatty acids it has. In a chain, if it has even number of fatty acids, it's considered harmful. If it has odd number of fatty acids, it's considered healthy. So that's the fundamental difference that we want to make. And what are those odd chain fatty acids? Dairy products, for example, low-fat dairy has odd chain fatty acids, and they are considered healthy by latest research. Then we have the bad fats. Those are saturated fats which come from animal fat. Red meat, for example, not the lean red meat, but the red meat that has a lot of fat is a bad fat. But what are the real ugly fats are called trans fats, which is basically how the configuration of the carbon and hydrogen bonding is. So it's a mirror image of the good fat, and that's called cis fat. The bad one is the trans fat, and trans fats are really ugly because they can actually cause fat deposition in the vessels of the supplying the heart and cause what is called as atherosclerosis, which causes the blockade and ultimately resulting in a heart attack. So the big controversy, and again to quote Donald Rumsfeld, who gave this famous quote, the known unknowns and the unknown unknowns and whatever. So what are the known unknowns here? One is the quantity of fat important or the quality of fat important? The American Heart Association in the 1960s said it's a quantity of fat which is very important. You have to reduce the fat and replace it with carbohydrates. And that had disastrous consequences. The amount of diabetes increased. In fact, even heart disease does increase depends on the type of fat that you're going to consume. The second question that we need to answer is what's the source of fat? As I said, animal sources of fat are quite harmful. and to be definitely avoided are trans fats. So in my next slide, I'm going to show what are the common foods that have good fats. So you have green leafy vegetables, cereals, but it's mostly millets, whole grains, quinoa and flax, which have the fats, good fats. The pulses and legumes, the kidney beans or the rajma that we call in India, the soya bean or the edamame beans, the black gram, and amongst the oils, it's the mustard or the canola or the rapeseed oil, groundnut, and olive oil. So these have the good fats. The next question that we want to ask is, what are the foods that we should avoid which contains high trans fatty acids? Deep fried foods have high trans fatty acids. Why is that? When you heat the oil to hundreds of degrees of centigrade, the cis fats converts into trans fats, and therefore it is advised that you should not reheat your oil. You should not use oil that has been used already, and use oil to the minimum for frying. Prefer shallow frying or deep frying. And these are the foods which are high in trans fats, like noodles, cakes, biscuits, and confectionaries, deep fried Indian sweets, cookies, donuts, potato chips, French fries, all that we like. So all of that have very high trans fats. Then there's a special kind of fatty acid called omega-3 fatty acid. You just need to know the term. It is useful in thinning the blood, thereby preventing heart attack. It's present in high-fat fish, such as salmon and mackerel. These omega-3 fatty acids lower blood pressure, they improve blood sugar control, improve heart health, and help prevent cancer and improve depression. And the best sources are salmon, whitefish, flax seeds, walnut, and canola oil. So this is all about the facts that we need to know. These slides will be available so you can look at it at your leisure. The next question that we would want to ask is, many people ask me this question, Doctor, which oil should I use? So most people say that olive oil is good, but for a country like India, for example, olive oil, even here, olive oil is quite expensive, and olive oil has to be cold pressed virgin olive oil for it to have all the benefits. Therefore, simple advice is avoid oils that are solid at room temperature. So you might ask, why not coconut oil, which has become very popular? The data on coconut oil is very preliminary. It will take some more time for us to say whether it's good or bad. It is solid at room temperature because of the saturated fat it has, but the kind of saturated fat it has is supposed to be because it has short chain fatty acids and supposedly healthy, but we do not have the last word on it. Ghee is considered good, but have it in very small quantities. Again, as I said initially, one of the philosophers said anything that is eaten in excess can become poisonous. Then the next philosophy is in Indian cooking, particularly North Indian cooking, is they use different oils for different foods. If you're cooking aubergine, you use a different oil. If you're cooking some other pulse, you use a different oil. That idea is very good because it gives you the right mixture of fatty acids. So change your oils frequently. For this month, you're using canola. Next month, you could use olive. Next month, you could use rapeseed. So you change your oils. So the final question that people ask is, there has been so much of literature for the last 60 years. People have been saying, don't eat fats, don't eat eggs, don't eat this, don't eat that. Why is that inconsistency? So as I said, all saturated fats are not the same. They are different because of the type of fatty acids they contain. Saturated fats from dairy products with short chain fatty acids may be better. The second thing is saturated fats raise both good cholesterol as well as bad cholesterol. And so it's the ratio that is important. And so if you're having a lot of animal fats, then it's bad. Bruce is here. You would say that it's very important that we address climate change. And one of the things the IPCC, which gave a report on what should be done for climate change, said that if everybody in the world became vegetarian for one day in a week, the global temperature would reduce by 1 degree. So that's the power of being a vegetarian at least once a week. So if this is India specific, for Indian diets, mustard or groundnut oil or rotating other oils may be a good idea. And I said avoid reheating and rancid oils. Ultimately, what is important is the portion size. Try and reduce the portion size. I mean, this philosophy of Big Mac and Big Coke has to go. We have to reduce it to we have to eat to our needs and not to our, you don't have to overeat. There are also people who argue that, the French, the Italians, the people who live under the Mediterranean region, the Okinawans, and several other populations across the world eat a lot of fat, but they live longer. Why is that? So to answer that question, we should look at what they eat in terms of fat. I just put here a comparison of Mediterranean diet and Indian diet. The oils in the Mediterranean diet is olive oil, whereas Indian diet is okay. They use groundnut oil or mustard oil. The main component of proteins in the Mediterranean diet comes from more fish, seafoods, chicken, and legumes, but less red meat. In the Indian diet, it comes largely from legumes and less from non-vegetarian food. So far, so good. The omega-3 fatty acids is basically fish, and in Indian diet, it comes from mustard oil and flax seeds. But look at carbohydrates. The Mediterranean diet comprises of whole grains, complex carbohydrates, and more fiber. Whereas the Indian diet consists of refined cereals, polished rice, and processed foods. Dairy, there's low consumption, and in Indian diet, frequent use of dairy in beverages and desserts. Fruits and vegetables, it's fresh, raw vegetables and fruits are eaten in the Mediterranean diet, whereas the fruit and vegetable consumption is extremely low in the Indian diet. The alcohol that is consumed is wine, largely. In the Indian diet, it's if they consume alcohol, it's beer and whiskey. So there is a fundamental difference in the way, even though they consume a lot of fat, there's a fundamental difference between these two groups of population, and therefore you can see the difference. The other question which has troubled most people is the cholesterol conundrum, as I call it. Is cholesterol, does dietary cholesterol make a difference? You eat more cholesterol, does your blood will your blood have more cholesterol? Do dietary saturated fats increase serum cholesterol? And do dietary cholesterol and saturated fatty acids increase mortality due to heart disease? This question has plagued cardiovascular researchers for the last 60 years. And what's the answer now? There are several follow-up studies that show no association between dietary cholesterol, because the cholesterol, there is a feedback mechanism. You eat more cholesterol, it gets metabolized in the liver, and therefore it's thrown out there's a transport mechanism by which it gets thrown out. So therefore, even if you eat more, there is a regulatory mechanism in the body to take care of it. So it is said that eating 1 or 2 eggs a day really does not matter. In fact, it has been shown by several large studies that saturated fats may be neutral or protective. However, the cholesterol level depends on the baseline consumption. If you are eating too much of cholesterol, like for example, somebody is eating 1 kg of prawn every day, obviously the blood cholesterol will go up because it breaks that regulatory barrier. But on moderation, having 1 or 2 eggs or a little bit of lobsters or prawns really does not matter. So this is about fats. Let me move on to carbohydrates and sugars. What are the key issues that we need to think of in terms of carbohydrates and sugars? First is we need to reduce consumption of simple sugars. As I say, there are 3 white poisons: sugar, salt, and in India we call it maida, and here I think you call it all flour. So these are the 3 white poisons because they have the lowest glycemic index. Sugar you eat, it gets directly absorbed into the blood. And salt obviously increases blood pressure, and all flour has very low glycemic index. Some people add rice to it, but rice has got a better glycemic index than this all flour or the white flour that we use for making breads. They are energy, and we need to avoid energy-dense, nutrient-poor foods and beverages, including the fruit juices. Many of us think that fruit juices are good, but if you will have to carefully select your fruit juices. Look at the fruit juices and say in the label, no added sugar or added sugar, because many of these fruit juices have added sugar, and that's pretty bad. Substitute foods with low glycemic index and high fiber content, and avoid excess energy intake such as fats, sugar, and alcohol. I'm going to show a study which we conducted where we compared the dietary patterns of people living in the United States based on a large survey which is conducted by the US Enhance group. which provides data on what people consume and what are their cardiovascular risk factors and so on, versus a cohort study that we are conducting, where we are following up individuals in Delhi and Chennai and see what they're eating and looking at whether they're going to develop heart disease or not. So this is the pattern that we observe. So when you look at the number of vegetarians, India obviously has higher number of vegetarians at 33%, whereas the number of vegetarians in the United States was 9%. But when you look at the prevalence of diabetes, for example, the prevalence of diabetes in US was very similar to India. 9% diabetes in India and 9% diabetes in US, whereas the prevalence of vegetarianism was 33% in India and 2.4% in the US. Now, why is there this paradox? Despite being a vegetarian country, why are we having such high burden of diabetes? So we looked at what happens to vegetarians in both the population. Vegetarians in both populations had a lower probability of overweight, obesity compared with non-vegetarians, but also had stronger protection against central adiposity or pot belly in the common parlance. And this association was stronger for the US vegetarian diets as compared to the Indian diets. Actually, the US vegetarians were better off than the Indian vegetarians. Now, why is this? This is because I call Indian vegetarianism as a contaminated vegetarianism. We have deep fried foods, which are rich in trans fats, which are extremely dangerous and should be avoided and reduced as much as possible. Indian sweets are not only loaded with sugar, but are high on trans fats. And trans fats cause atherosclerosis, deposition of that waxy substance in the blood vessel that supplies blood to the heart, and cause plaque formation and results in heart diseases. So you are bombarding your heart which results ultimately in insulin resistance, and the insulin fails and you develop diabetes. So this is a very diabetogenic sweet. I'm very fond of this. This is called Mysore pak. But sometimes I think, should I call this as a Mysore plaque, because it goes and gets directly deposited in your artery. So moving on, let's talk about some of the micronutrients, vitamins, antioxidants, and heart diseases. So there's a rationale that vitamins are good. So the question is, do you have to pop a vitamin pill every day to protect yourself from heart disease? The answer is no. Because a lot of studies have shown that taking vitamins are not useful. They are neutral, sometimes harmful. Now you might ask, why is this? When you take foods that are rich in vitamins like fruits and vegetables, etc., it's very beneficial. But you're taking vitamins, it's not beneficial. So there is a temporal dissonance. That is, you eat your lunch, which is heavy, which has a lot of oxidants, and then you take an antioxidant during your dinner. How is it going to help? So you have to take those natural vitamins which are part of fruits and vegetables. So the suggestion is to use berries and brightly colored vegetables, which are good source of antioxidants. The role of vitamin D is still not yet clear, and there are a lot of studies which are ongoing, which will give us the answer in the future. What about fruits and vegetables? Fruits and vegetables are protective against heart attacks. They protect against strokes. They reduce blood pressure. They reduce blood sugar. Berries are rich in antioxidants. Eating them can reduce multiple risk factors for heart disease. The WHO recommends that we take 5 servings. What is 5 servings? A small cup with cut fruits or vegetables. 5 of those throughout through a day. That is what we should be taking. But one difference between the Indian and the American vegetarian diet, which I forgot to mention that time, was the way we cooked our vegetables. The Indians beat the vegetables to death by boiling it and by heating it. So if you look at the salads that are eaten here, it's basically raw salads, which has a lot of color, a lot of antioxidants and several other nutrients in it. Whereas we boil the vegetables and that gets neutralized by boiling. So I think the cooking practices are also important. Now, most important question, a lot of people say, what about alcohol? So is there evidence that alcohol is beneficial? Several studies have shown that there's what is called as a J-shaped relationship. That means Higher the alcohol you consume, higher the chances of having several diseases, including heart attack, stroke, etc. But if you consume low amounts of alcohol, or they call it as moderate alcohol consumption, it is supposed to be beneficial for the heart. But is this really true? The jury is still out. A lot of people really do not know whether it's beneficial or not. It may be neutral, it may not be causing any harm. But there are certain ethnicities, like Indians, for example, where Indians and Chinese, it's been shown that alcohol is harmful even at moderate doses. The reason is basically because of the drinking pattern. Most people in the West drink alcohol with meals, whereas in India and China, alcohol is drunk before meals. The second problem is there is a lot of binge drinking that happens. So people may not drink over the whole week, but on Sunday or on a Saturday, they may have 6 drinks, which is extremely harmful because it can raise blood pressure very rapidly. It can cause irregularities of the heartbeat. The third is there is a difference in the way alcohol is metabolized in the Caucasians as compared to other ethnicities. We have 2 types of alcohol metabolizing enzyme called alcohol dehydrogenase. So we have alcohol dehydrogenase, which metabolizes extremely slowly. So there is a high addiction potential. And therefore, due to a variety of reasons, medical advice is not to start alcohol if you're a non-drinker. And if you consume alcohol occasionally, you having an occasional wine or a glass of wine really does not matter, but making it frequent is going to be problematic. And if for people who drink alcohol every day, you have to give at least 2 off days in a week, 1 or 2 off days in a week. And the day you consume, don't drink more than 2 drinks. The recommended intake is 14 units of alcohol per week, which means 2 drinks. That's only for men, and 7 units for women. So this is the advice with regard to alcohol. But there are a variety of reasons why you should not be drinking alcohol, because it increases injuries, domestic violence, accidents, so on and so forth. That's the public health advice. With regard to salt, we all know that high salt increases blood pressure. There has been some controversy which has been injected recently saying that at very low levels of salt, people have problems. But that's a special population. People have heart failure, people are dehydrated. In them, consuming very less salt can be harmful. But the general advice is to reduce salt as much as possible. And that's good. So the simple ways of doing it is don't add salt to salads, don't add salt to yogurt, for example, which a lot of Indians like to have separately. So if the salt, if the in the food is appears to be a little low, don't add extra salt. So those simple, and avoid foods that are very rich in salt, like pickles and papadums and others. So that takes care of the salt business. So these are all individual things. It's very difficult to remember. One way of remembering is what is called as a plate model, which I'll show how to plan a meal. So you take a plate and divide it into 3 portions. So one portion should consist of fruits and vegetables divided over the day. The second portion should consist of bread and cereals, but it's whole grain breads and cereals. The third portion should be divided into 3 parts. One part should comprise of milk and dairy products. The second part should contain of foods containing fats and foods containing sugar. And the third part is meat, fish, and alternatives. So if you follow this principle over a day, over a week, then I think your food can become healthy, because it's very difficult to actually think in terms of how much fat should I eat, how much carbohydrate should I eat, how much sugar should I eat. But if you have this general pattern, that 1/3 of a day's meal comes from fruits and vegetables, that itself is a very good message in terms of maintaining a good diet. The other thing is, a lot of people ask this overnight fasting business and having 2 meals over 8 hours and keeping 16 hours of fasting. It's a good idea to lose weight, not at all a bad idea, but is it sustainable? And the other problem that it causes is it can increase your blood sugar very high at times and then make it very low. You have to keep your blood sugar within a narrow range, and therefore eating 2 or 3 meals a day is a very good idea. But keeping prolonged fasting, while evidently helpful in weight reduction, is not a sustainable way of having a healthy diet. So what are my recommendations? Eat more of healthy fats, raw nuts, olive oil, fish oils, flax seeds, or avocados. In terms of nutrients, colorful fruits and vegetables, fresh or frozen, prepared without butter. In terms of fibers, cereals, breads, and pasta made from whole grains or legumes. In terms of omega-3 and protein, fish and shellfish and poultry. And in terms of calcium, egg whites, skimmed milk, low fat or non fat cheeses, and yogurt. I think eat more of these. What should we eat less? Obviously, you should avoid trans fats from partially hydrogenated or deep fried foods, saturated fats from whole fat dairy or red meat, packaged foods of any kind, especially those high in sodium, white or egg breads, granola type cereals, refined pastas or rice, red meat, bacon, sausage, fried chicken, egg yolks, and whole milk products like cheese or yogurt. So this is about the diet. Moving on, let's look at smoking. Most important thing is smoking has 3,000, virtually 3,000 harmful substances. It can damage every part of the body. Most of us think that it causes cancer, lung cancer. A few others, if you ask, they'll say it causes heart disease, but it can actually affect every part of the body. And as you can see, the big list of things it can cause, from stroke, blindness, gum infection, dilatation of the aorta, which is the largest blood vessel in the body, and it can cause its rupture, heart disease, pneumonia, thickening of the arteries, chronic lung disease, hip fracture, reduced fertility. So a variety of diseases smoking can cause. And the other important point that has been observed in a very big study, which has actually come from Canada by Professor Salim Yusuf from Hamilton in Ontario, shows that it's dose dependent. The best is not to smoke. Even if you smoke one cigarette, the risk increases. But as you smoke more number of cigarettes, the risk increases further. So a lot of people in India come and ask me, this is about cigarette. Do you think chewing tobacco is okay? Do you think taking snuff is okay? So they actually analyze the data to show that any form of tobacco, be it filtered cigarette, be it pipe, be it BD, which is a form of tobacco that we use in India, or pan masala, which has chewed form of tobacco, all of these are harmful. These increase the risk of heart attack by 3 times. So avoid tobacco as much as possible. And what are the benefits of stopping smoking? After the last cigarette, within 30 minutes, your blood pressure returns to normal. Within 8 hours, the carbon monoxide in the blood comes back to normal. By 24 hours, the cells lining the blood vessels are coming back to normal. By 72 hours, the breathing becomes easier. By 2 to 12 weeks, the lung function improves. And at the end of 1 year, the risk of heart disease is halved. And by 3 years, the risk is almost equal to the non-smoking person. And by 5 to 15 years, the risk of stroke is reduced as equivalent to a non-smoking person. And by 20 years, actually, you can reverse whatever has happened. So if you are a young smoker, stop smoking today. And even if you are an elderly smoker, stop, because you will have innumerable benefits from stopping smoking. The third point, we looked at the triad of diet, smoking, and physical activity. And we saw that it causes 4 major diseases, resulting in 50% of the mortality worldwide. So physical inactivity is an important risk factor. And physical inactivity is as bad as smoking. In terms of global deaths per year, smoking causes almost 5 million deaths a year. And physical inactivity is equivalent, 5 million deaths a year. So how does physical activity prevent heart diseases? First, it prevents diabetes and improves glucose metabolism. It increases the good cholesterol. It decreases the bad cholesterol, decreases blood pressure, decreases body fat, and decreases obesity. In addition, it has non-heart disease related benefits. It can reduce osteoporosis, one of the commonest reasons for fractures in the elderly. It can reduce the risk of breast and colon cancer. It reduces the risk of lower back pain, stress. It's one of the best treatments for stress, anxiety, and depression. And it increases strength and fitness. So it's important to be physically active, and I'll tell you what is the recommendation by the WHO. The second thing, like sitting, is an important risk factor. It has been recently identified that sitting is equivalent to smoking. So if you're sat for a long time, you're sat for almost 40 minutes, please stand up, no problem. Stand for 2 minutes and then you can sit. So if you're a sedentary worker working in an office, it's advisable that after every 30 minutes of sitting, just get up and walk around for a minute or so and come back to work. Most people nowadays have these standing desks, which are actually a good idea. So the WHO recommendations is that physical activity includes any of the recreational or leisure time physical activity. The second type of physical activity is related to transportation, how you reach your offices by walking or by bus or by car. Household chores and sports are planned exercise. So one should incorporate physical activity in the context of daily family and community activities. So the WHO recommends at least 150 minutes of physical activity, moderate physical activity in a week, divided over a 5-day period or so. So it essentially means 30 minutes of brisk walking every day for 5 days a week. That's a basic minimum that we need to use. If somebody has to lose weight, it should double it, go to 1 hour per day for at least 5 days a week. And then there should be some muscle strengthening activities that should be done at least once or twice a week in some form of weightlifting or push-ups or things like that. This is all the physical activity that is required to keep your heart healthy if you're not obese. If you're obese, you have to lose weight first and then maintain this activity. Now, what happens to people who had a heart attack? This is a 100-year-old picture where this young person has had a heart attack and asks this question: what can we do to stop it happening again? And this is the question asked by most people who have a heart attack even today. They'll ask the doctor, what can I do to prevent another heart attack? And there are only two important things that we need to do. We call it secondary prevention, and that involves two components. One is use of simple drugs. There are 4 simple drugs that would prevent a heart attack, and that has to be prescribed by your doctor, and you have to take that. But the second important component is what is called as cardiac rehabilitation. We have to rehabilitate that individual so that the person does not have depression, returns to activity as it was before the heart attack, and helps that person to come back to normal activities soon. And we think that yoga can play a major role in cardiac rehabilitation. Now, how does yoga help is what we can look at. So this is some of the work that we have done in yoga. We have created a heart-friendly yoga package and demonstrated the benefits of yoga in cardiac rehabilitation after a heart attack. We have done work on yoga in diabetes, yoga in cessation of tobacco use, and yoga in reversal of atherosclerosis. So the question is, yoga means different things to different people. A lot of people think it is the physical exercises, the physical postures. Some people think it's a breathing exercise. Some people think it's a meditation. To me, it's a lifestyle package, a complete lifestyle package. So it has, if you look at the original Patanjali Yoga, there are 8 things that have been described, and I'm going to show only 4 things here. Among the 8 things is keeping your environment clean. In fact, Patanjali has spoken about environmental pollution thousands of years back. So the complete lifestyle package consists of the right diet, avoidance of tobacco, and avoidance of alcohol, which you have spoken about. The second is stress relief through meditation and mindfulness. The third is various physical postures and physical activity. And the fourth is the pranayama, the breathing exercises. And the other 4 are listed here, which includes learning, your right attitude to work, and so on. But in the context of our people with heart attack, these 4 are very important. So what did we show in a large randomized trial? We did a trial of 4,000 patients in 24 centers in India, which was presented at the American Heart Association, published in the Journal of American College of Cardiology, shows that cardiac rehabilitation after a heart attack improved the quality of life. People who are in the yoga group had a better quality of life as compared to people who are in the usual care group. People who are in the yoga care group returned to their activities much earlier as compared to the usual care group. And we are actually following these patients up to see whether there is actually a mortality benefit. That will be published soon. We just completed the study and we are doing the analysis. So, as I've said, there are 3 or 4 very simple things that we need to follow. So my concluding message is for living longer and keeping your heart healthy. Eat in moderation. Don't be a martyr. Eat in moderation. Second, eat whole grain cereals and plenty of fruits and vegetables. Cook your food the right way. As I said, don't kill your vegetables. Reduce deep fried foods and other fatty foods. Reduce salt. Add color to your diet. Your food should be colorful, different colors, which means that you're eating the right healthy food. Overcome your destiny by eating right. So people say that heart disease is a genetic disease and nothing can be done about it. It's completely wrong, because you can win destiny by your right lifestyle. Then others, apart from diet, is avoid tobacco in all forms and alcohol as much as possible, moderate exercise and yoga. So there are two things. A male who lived till 101 years was asked, how did you get to live till 101 years? So he said, do not smoke even for the fun of it. Eat plain food, lots of beans and vegetables. Do not drink except for little wine. Walk a lot, work hard physically. Do not be concerned over politics. Avoid courts and doctors. Do not read newspapers. And in our current context, particularly in India, don't watch TV news. Remain illiterate. Sleep plenty. And with regard to sex, do your best. So the same question was asked to a woman, and this was published in, I wanted to give a Canadian example. It was published in Huffington Post. So a 109-year-old woman in Scotland said in January that the secret of her longevity is this: eat your porridge and avoid men. Centenarian Jessie Gallen, who never married, was born in a tiny two-room farm cottage where she slept top to tail with her 5 sisters and brothers on a straw mattress, reported the Daily Mail. Gallen told the newspaper that a secret to a long life has been staying away from men. They are just more trouble than they are worth. She noted that she also made sure that I got plenty of exercise, eat a nice warm bowl of porridge every morning, and have never gotten married. I mean, obviously, you cannot do that, but there is a subtle message. Both the man and the woman said, exercise, eat the right diet, don't smoke, drink alcohol as little as possible. These are the 4 important messages that I have to give in terms of lifestyle. So it's very important to add life to our years. We may grow old, but we need that life and that spark in our old age. As this Swiss writer said, to know how to grow old is the masterwork of wisdom and one of the most difficult chapters in the great art of living. But if you follow this healthy lifestyle, it's not going to become as difficult as what he says. Thank you very much. Yeah.
I was part of a health outreach team in India.
Yeah.
With nursing students and so on. They presented in community gatherings about diabetes and heart health and so on. It was well attended. After the meeting, guess what they served? Laddus and jalebis and samosas. So much for education at work. This is all very good. I guess my question is, at least the people in my circle, we all know all of this. We all know this information, but many of us struggle in, making the right changes. So do you have some kind of way which would help people to put all of this learning, all of this information into practice?
Right. I think this is a very important question and a difficult question to answer. Evidently very easy. So when you think of behavior change communication, because we want people to change their behavior, there are 3 things that we have to do when you look at behavior change communication. Number 1 is we have to provide the knowledge, as we are trying to do, so that the person can say that I know. You want people to have that knowledge. But the second thing is we have to empower that person. I mean, the biggest problem that we are having now, particularly in the medical profession, is telling a patient, don't do this, don't do that. But the person has to go to that same house where they do the same cooking. So we actually did a trial in Trivandrum where we did a family-based intervention to see that some modest changes happen in the family. You don't have to make major changes, but modest changes, so that the person who has a heart attack or the person who has a diabetes is part of the family milieu, so that there's nothing which is different for that person. So that's the second thing. So you're empowering the person and have the family partake in this, or the community partake in this. In fact, studies in Canada have shown wherever the community is not involved, none of these things really work. So you have to get the community buy-in. So you have to look at the grassroots movement rather than a top-down approach like me coming and telling that you should do this, you shouldn't do that. We have to ask the community as to what they prefer to eat, what they actually try to do, and so on. The third thing that requires is we have to make them change agents and demand from the governments and from the community to provide them with an enabling environment. What is an enabling environment? In Canada, you don't have a problem because you have parks and you have trails and you have all those kind of things. In countries like India, many cities don't have parks. Many cities don't have walkways. It's dangerous to walk on the road. So until we provide that enabling environment, nothing changes. So I think all the components which I mentioned are important. It's not only about knowledge. You're providing the knowledge, but people don't change their practice. To change their practice, you have to have an enabling environment. And actually, it has to come from within. It has to come from, they have to provide the solution. Yes.
Hello. Okay.
Yeah.
So for a bunch of families who say live paycheck to paycheck, who can't really afford healthier options, especially nowadays because groceries are just a lot more pricey. Do you believe that, or to what degree can a sustainable calorie deficit play a role in heart health?
Right.
Yeah.
I actually didn't want to get into that controversy because undernutrition, particularly in children, in mothers, can increase the risk of heart disease later on in life. So that is a policy dimension. The question that you're asking is a policy dimension, because mothers who are pregnant, infants have to be supported by the government or by some other social security mechanisms. So that's an important thing. The second question which you asked is, given that healthy foods are so expensive, how do you encourage people to take healthy foods? So there is a bit of a issue over there, in the sense we have always been taught an apple a day keeps the doctor away. Is it? It may, but why not a berry which is cheaper? Why not some other fruit which is locally grown, which is cheaper? Because all fruits and vegetables almost have the same benefits. Apple may have a little more benefit, or some exotic fruit like grapefruit may have a little more benefit, but essentially all fruits and vegetables have virtually the same benefit. So my advice, whenever I give this talk in India, is use locally grown, inexpensive, seasonal vegetables and fruits. Right? If aubergine is very cheap at a given point of time, use that. If carrot is cheap, use that. Like in India, for example, many people from India are here. Carrot is available during the winter, so they make carrot halwa, they make carrot this, carrot that. So use the vegetable that is locally available, seasonally available, and it's inexpensive.
Thank you.
Thanks. You haven't spoken much other than your most recent statements about the role of childhood nutrition and childhood activity and the genesis of adult disease, nor about epigenetics, the influence of what the mother is living through and the young child is living through in terms of what ultimately happens. Could those be important, and in what way are they important?
Right. I think I didn't talk about it because I was told this is a very general audience, mixed audience, and that's a very important point that you made, that there are epigenetic changes, the changes that happen in your gene because of undernutrition. So in the first 2 years, whatever change that happens is reversible if we give them the right food and take care of the nutrition at that time. Physical activity is also important. It is said after 2 years, it's difficult to correct that, but we don't have that exact proof. But one point that requires to be made is actually this is a tragedy, because it not only affects the next generation, but it can affect the third generation. A pregnant woman who's short, who's undernourished, bears a girl child whose oocytes can undergo epigenetic changes, and that can be transmitted to the next generation. So it's a big social problem transmitted across generations. And therefore, the clear message is we have to take care of the mothers and we have to take care of the children, at least till they grow. So the worldwide, initially, they used to criticize this midday school programs and the feeding programs. But some of the development that has happened, some of the growth, economic growth that has happened in many of the countries, including in India, has been because of these programs. So that's a point very well made. And I thought it's a different audience. I didn't want to talk about it.
I'm just gonna sit. I was just wondering about the question with the family history and the age and genetics with related to like cholesterol. Like you hear that, you know, if you do diet, exercise and everything right, and then your cholesterol level's still up. Because a lot of doctors say you need to go on cholesterol pills, but then that prones you to diabetes. If you do everything right, is it true that it's always genetic related if your parents have it or grandparents have cholesterol, but you're doing all the right things and still your cholesterol's up? Is that genetic related? Because it's kind of like a position that I'm in right now, kind of thing. You try to do everything right, eat right, exercise, and how does that disposition you to a high LDL or the bad cholesterol?
Right. I think that's a very insightful question. So the thing is, we have to understand that 25% of the people who have a heart attack do not have any of these risk factors. These 25 people, you say there are no risk factors. Is it genetic? We actually don't know the exact reason why those 25% of the people have had a heart attack. It could be something which we really do not know now. It may be a random chance. As you grow older, the chances of developing a heart attack becomes higher. But to answer your question, it's a spectrum. There are around 10% of the population who have very high risk because of bad genes. And they require a different form of treatment. There is something called familial hypercholesterolemia. Those people with what is called as homozygous familial hypercholesterolemia cannot even be controlled by statins. They may be controlled by PCSK9 inhibitors, but they may ultimately require a liver transplant because the enzyme which metabolizes cholesterol is absent in them. So that's an extreme end, right? There are lots of people in the middle who can benefit from these simple changes. I'm not saying that you should make major changes, because what we have learned in the last 50 years is 2 or 3 things. Number one is an isolated elevation of a single risk factor. Like, let us say somebody has cholesterol of 200 and everything is fine, non-smoker persons, right? The risk is not very high. But on the other hand, you have small elevations of risk factor. The person's blood pressure is 132. Cholesterol is, I mean, in the way it's measured here, let us say it is 5. And blood glucose is, let's say 12. That person has a very high risk as compared to somebody who's got an isolated elevation. And you target this person who's got slight elevation of risk factors, they can really benefit from lifestyle changes. So the majority of the population is constituted by these people who have small elevations when they are around 30, 40 years. You catch them at that time and they modify their lifestyle. So when they grow older, they don't have the risk factors. That's the whole idea. But I'm not saying that, that 10% of the population, they can be corrected by this. No, they cannot be corrected by this. They require a specific form of treatment. Insulin-dependent diabetes will require a specific form of treatment.
Just to add to that question, so if that small middle part of that person, the cholesterol, like say you said it was 12, and then the mid part has the other risk factor, and so is it a recommendation? I know with the WHO Association or anybody, I know majority of doctors want to put you on statins, but then that predisposes you, if you're on statins, to go on to diabetes medication. So a lot of people like myself, I'm a naturalist. I try to avoid going on any kind of medication, but is it a better risk to go on the medication to avoid that heart attack? Because there's that calculation with age and what your levels are at. If you tried the diet, exercise, is because then you're going into other risk factors like your diabetes, and then that will cause other problems, right? So is there a better risk factor to go on the medications or not? I know it's all individually based, but because once you go on it, you have other
Right.
pros to disposition to osteo and other things.
So what you really need to do is what we call as a risk benefit analysis. What is the benefit of taking this drug? Is the benefit of taking this drug is worse than the risk of what we're having? If the benefit is higher than the risk, then you take the medicine. Like, for example, what is the risk of getting diabetes by taking statins? It's around 1% over a 10-year period. But what is the risk of not taking statins? 10% risk of heart attack, in which case I would give the statin despite that small increase in risk for diabetes. So this has to be done in consultation with the doctor. So this is an individual advice. What we are talking here is a population advice as to what we should do.
Thanks so much. I can't resist to ask a question.
Yes.
And you're probably going to know what it is because just for full disclosure, I'm also a lawyer. So what does the law have to play in incentivizing and disincentivizing and helping with some of the behavior change that you are suggesting? So I'll ask specifically around, say, for example, advertising or regulation of fast foods and high sugars and energy drinks and everything else that bombards us with information and all of those tasty morsels on billboards and television and radio and children's programming. Do you think that the law and regulation has a place, or is it much more about the individual and the person?
So the answer to that question is, I think we are all victims of what the society has done. So there's no I don't think we should do the victim blaming and victim shaming. I mean, there is no question of disincentivizing individuals. But in terms of policy, non-personal policy interventions play a major role. Take the example of United Kingdom. Over a 50-year period, they managed to reduce heart diseases by 50%. And how did they do it? So one is they strengthened primary care. They provided, identified disease earlier and started treating them. But more importantly, one example is salt reduction. Now, today, if we try and reduce, today I take 10 grams of salt, and because I have heard this lecture, I want to make it to 5 grams. It's not going to be possible. Food is going to taste horrible. It's not going to be tasty. So what did they do? Bread around in the 1980s, bread in the United Kingdom had very high salt content. So they called the industry and told them that either you regulate yourself or we are going to regulate you. And the industry said, okay. So what they did was they reduced salt by 5% every year. Right now, if you go to UK and have a bread, it tastes very different from bread in many parts of the world. That's because people don't perceive that difference when you do it in a slow and phased manner. Then there are other non-personal policy interventions, like take the example of wafers, the potato chips. Earlier, they used to cook potato chips with the salt. Now, what they're doing is they change the cooking practice. They cook the potato, but sprinkle salt. So the amount of salt in the potato chips is almost comes to less than 75% or 60% of what they were adding. Simple non-personal policy intervention like tobacco, for example, doubling tax on cigarettes actually increases the revenue to the governments threefold. It's been shown in France and in South Africa. The doubling tax increases the revenue by three times. So simple things like taxing tobacco products, pictorial warnings, stopping advertisement, including surrogate advertisements, because tobacco companies are very good at surrogate advertisements. So all these three measures have actually shown to reduce, and banning smoking in public places. One of the things in UK pubs and in Scotland was when they started this banning of smoking in pubs, people were frightened that the business will go down. In fact, the business improved because the non-smokers started coming in. And they had the real benefit within 1 year. There was a 17% reduction in heart attack admissions. So you can get benefits very fast by regulation. So regulation is required for tobacco, for alcohol. Like, for example, I was very surprised in BC, alcohol shops open at 9 o'clock. BC liquor opens at 9 o'clock. But instead of opening at 9 o'clock, we open it at 2 o'clock. You can actually reduce alcohol consumption by 10-20%. This has been shown. I think you require some regulatory frameworks by which you can intervene in people's behaviors without actually them perceiving that there's an intervention. Then providing an enabling environment, encouraging physical activity and so on, encouraging use of public transport, carpooling. A lot of things can be done by regulation. The biggest regulation that came about 50 years back, nobody was wearing a seat belt. One simple regulation reduced millions of deaths across the world. So that's a power of policy. And therefore, non-personal policy interventions are very important. So disincentivization, incentivization should be at the policy level, but not for individuals.
Thanks. All right. Are there any other questions?
Yes, thank you for the talk. I had a question about the vegetarian paradox. And it's still a pretty new hypothesis, and it's not the same as the take a tablet of aspirin a day, which we're sort of moving away from because of the GI bleeds. But if you eat vegetarian, your serum salicylic acid levels will be higher. And if you are vegetarian and you eat organic, they'll be higher still. So you're actually getting the equivalent of some aspirin without taking a pill. Could that be part of the explanation for the differences in vegetarian diet? If you're really cooking it so much, maybe you're getting rid of not only some of the other nutrients, but also things like salicylic acid.
I don't think so, but I think the most important thing is the confounder of, the people who participated in the NN's program may be a healthier population. They may have a health-seeking behavior. And who are the vegetarians in US? They're people with health-seeking behavior. So they're a different breed of people. They exercise more. They come from upper socioeconomic status and so on and so forth. This is a cross-sectional comparison. It has its own limitations. But I just want to make the point that vegetarians in the US eat vegetarian food in a very different way as compared to the Indian cooking.
Wonderful. Well, with that, I think we have some non-heart healthy snacks outside, as all such talks should end with displays of behavior that we do not want to incentivize. And I will thank you all for coming. And Dr. Prabhakaran, thank you so much for a wonderful talk. And I think we will all go home and eat more right diet.
So as I said, moderation, not martyrdom, should be our motto.
Yes. Wonderful. No martyrs here. Thanks.